Yes, guys, welcome back. So, shall we resume the next session? Everyone is available there. I hope you are there, guys. Yes, a big thumbs up. Yes, very good. So, we'll be seeing about the next region of the phloem, that is called as popliteal fossa. See, popliteal fossa is one of the important question which were been frequently asked in your UG days. Okay, and since it is an important area, we will also discuss about that today here. So what is popliteal fossa? Okay, if you see popliteal fossa, it is basically a diamond shaped fossa. It is basically a yes, yes, guys, we are back again. See, we were talking about the popliteal fossa. Okay, so popliteal fossa is one of the important fossa which is present on the posterior aspect of the knee. Okay, so where it is located? So the location of the popliteal fossa is on the posterior aspect of the knee. Posterior aspect of the knee, it is where the popliteal fossa is located. And what is the shape of the popliteal fossa? If you see the shape is like a diamond shaped fossa. Okay, it is like a diamond or a rhomboid shaped fossa. So okay, it is a diamond or a rhomboid shaped fossa. It is the shape of this fossa. So it has got four boundaries, guys. It has got four boundaries. Okay, so if you see the boundaries of the popliteal fossa, okay, so you got two boundaries here. Okay, these two boundaries are the superior-medial boundaries. Okay, so this is the superior-medial boundary. So the superior-medial boundary is formed by semimembranosus and semitendinosus muscle. Okay, so these two muscles forms a superior-medial boundary, and biceps femoris forms the superior-lateral boundary. Biceps femoris forms a superior-lateral boundary. Okay, and when you come to the inferior side, the infrolateral and the infromedial boundary is formed by the gastrocnemius. So the infromedial boundary is formed by the medial head of gastrocnemius, and the infrolateral boundary is formed by the lateral head of gastrocnemius. And if you note that along with this lateral head of gastrocnemius, you will see one more muscle running in this area. Okay, there is another muscle which is not shown in the figure, which runs in this area. The muscle which runs in this area will look like a rat tail like appearance, and this muscle which you see here is nothing but the plantaris muscle, which also lie in the infrolateral boundary, So if you take popliteal fossa, it is a diamond shaped fossa. Okay, so it has got four boundaries. It has got superior-medial boundary and the infromedial boundary, superior-lateral boundary and the infrolateral boundary. Okay, so in the picture, how to check which is medial and which is lateral? You must look into this tendon. If you see a semitendinous muscle here, so that is on the medial side, that is the superior-medial side. So that is the superior-medial side. Okay, guys, clear? So these are the boundaries. So superior-medial boundary is formed by semitendinosus and semimembranosus. Superior-lateral boundary is formed by biceps femoris. Okay, inferior-medial boundary is by medial head of gastrocnemius, and the infrolateral boundary is by the lateral head of gastrocnemius and by the plantaris muscle. Now what is the structure which forms the roof of this? So the roof of the popliteal fossa is formed by the skin. It is formed by the superficial fascia. It is also formed by the deep fascia. Deep fascia in this region is called as the deep fascia in this region is called as what? It is called as a popliteal fascia. So you always remember, guys, deep fascia is given special names in various parts of the body. Okay, deep fascia is given special names in various parts of the body. For example, in the thigh region, okay, in the thigh region, deep fascia is called as, the fascia lata. I hope you know that. So in the thigh region, it is called as fascia lata. So in the perineal region, it is called as Buck's fascia. In the popliteal region, it is called as popliteal fascia. Okay, so in similar ways, so it is only the deep fascia in the neck region. Again, it has got an investing layer of deep fascia. It has got an pretracheal fascia. It has got an carotid fascia. So all these deep fascias in the neck are given special names, and the deep fascia in the popliteal region is called as the popliteal fascia, is called as popliteal fascia. You can also see in the roof, okay, you can also see in the roof small saphenous vein, okay, you can also see small saphenous vein in the roof, okay. You can also see the posterior cutaneous nerve of the thigh in the roof. You can also see the posterior cutaneous nerve of the thigh in the roof, okay. So these are the structures which are seen in the roof of the popliteal fossa, okay. Now what is the structure which is forming the floor of the popliteal fossa, okay. So floor of the popliteal fossa is formed from above downwards by floor of the popliteal fossa, which is formed from above downwards by the distal surface, distal femur, okay. It is formed by distal femur. What part of the distal femur? It is the posterior surface of the distal femur which forms the floor. Next comes the oblique popliteal ligament. Next comes the oblique popliteal ligament. Next comes the oblique popliteal ligament. And the next ligament or next muscle which you see here is the popliteus muscle, is called as the popliteus muscle, okay. So if I want to show you the floor here, guys, okay, I'll just make a simple diagram here. So you can see the distal femur, okay, it is forming the medial and the lateral condyle, and what you see here is the proximal tibia, okay. It is again the posterior surface of the proximal tibia. Sir, you can ask me, sir, how you say this is posterior surface of the proximal tibia, okay. So when you see a line like this running in the proximal tibia, this is posterior surface. And what is this line, guys? Anybody can tell me what is the line that divides the posterior surface of the tibia into upper 1/3 and distal 2/3? What is this line? There is one important muscle that gets attached to this line. Anybody? What is this line called as? Yes, I am waiting for your answers. Yes, guys, what is this line which is seen on the posterior surface of the tibia, which is separating the tibia into upper 1/3 and distal 2/3? So this line is called as soleal line, guys. This line is called as soleal line. Very good, guys. Very good, Mugundan. Very good, Anashwara. Yes, it is soleal line. It is the muscle soleus which takes origin from the soleal line. Excellent. Okay, so on the lateral side you have a bone called as fibula. You have a bone called as fibula. There is no doubt in it. So this is the lateral side and this is the medial side. Okay. Now when you see the posterior aspect or the floor of the popliteal fossa, the distal femur. Okay, so this is the distal femur which forms the floor of the popliteal fossa. Now there is a ligament which is running here. There is a ligament which is running here. This ligament is called as the oblique popliteal ligament. This ligament is called as oblique popliteal ligament. This ligament is called as oblique. Okay, so this ligament is called as oblique popliteal ligament. Okay, this is called as oblique popliteal ligament. And how this oblique popliteal ligament is formed? There is a muscle called as semimembranosus. There is a muscle called as semimembranosus which gets inserted into the medial condyle of the tibia. After it's inserted, it gets reflected back and forms this ligament. Okay, so if somebody asks you how oblique popliteal ligament is formed, okay, how oblique popliteal ligament is formed, okay, it is nothing but a remnant or the continuation of a muscle which is called as semimembranosus, You will see similar kind of ligaments, similar kind of muscles in various parts around the knee joint. So the first thing, similar kind of thing what we are learning now is oblique popliteal ligament. So oblique popliteal ligament is just a remnant of semimembranosus muscle, or it is a continuation of semimembranosus muscle. Okay, so semimembranosus muscle, I think you know that it forms the superomedial boundary of the popliteal fossa. Now coming to the inferior part, there is a muscle which takes its origin from the lateral condyle of the distal femur and it runs into the proximal tibia and it gets inserted into the proximal tibia. This muscle is an important muscle in this region and this muscle is called as a popliteus muscle. And what is this muscle called? This muscle is called as a popliteus muscle. Okay, this muscle is called as popliteus muscle, and this muscle is covered by a fascia here. This muscle is covered by a fascia here. This fascia which is seen, sorry guys, so there is a muscle which is here. This is called as a popliteus muscle, and this muscle is covered by a fascia here, and this fascia what you see here covering this is called as the fascia covering the popliteus muscle. So what is this? This is the fascia covering the popliteus muscle. So this is popliteus, and the fascia, what you see here, the yellow color represents the fascia covering the popliteus muscle, Okay guys, clear? So these are all the structure which forms the floor of the popliteal fossa. So what are the structure that forms the floor of the popliteal fossa? It is the distal femur, it is the oblique popliteal ligament, it is the popliteus muscle, and the fascia covering the popliteus muscle, Okay, so one more important MCQ, one more important topic in this region is the structure which pierces the oblique popliteal ligament. This has been asked in the previous years. Okay, so the structure which pierces the oblique popliteal ligament is, it is a middle genicular, vessels, okay, it is a middle genicular vessels, and the posterior division of obturator nerve. It is the posterior division of obturator nerve. Okay, it is the posterior division of obturator nerve. So guys, please remember the floor of the popliteal fossa is important. It is formed by the distal femur, it is formed by the oblique popliteal ligament, popliteus, and by the fascia covering the popliteus. When you talk about oblique popliteal ligament, okay, it is a remnant of, or it is a continuation of semimembranosus, and it is pierced by two important structure. One is called as a middle genicular vessels, which supplies the ligaments within the knee joint, and next is the posterior division of the obturator nerve, which supplies sensation or sensory part to the knee joint. So these are about the floor of the popliteal fossa. I hope you are clear with the boundaries of the popliteal fossa. Yes, so it is a fossa which is present on the posterior aspect of the knee. It has got superomedial and superolateral, and the infromedial and infrolateral boundaries. So it is a diamond shaped fossa. It has got roof and has got a floor. Now what is present within the popliteal fossa? Okay, so that means you should know the contents of the popliteal fossa. So what is present in the popliteal fossa? So you know about the contents. Okay, there is nothing to tell in this. The first content is the popliteal artery. Okay, popliteal artery is nothing but a continuation of femoral artery. Okay, popliteal artery is nothing but a continuation of femoral artery. Okay, and next is popliteal vein. Okay, next is popliteal vein. Okay, and the next structure which is present in this is the two divisions of sciatic nerve. Okay, if you see here, the sciatic nerve, when it reaches the superior angle of the popliteal fossa, it divides into two, one here and one here. One is running along the superolateral border and one is running straight down. Okay, so the two nerves which are seen in this area are, one is the tibial nerve and another one is the common peroneal nerve. Okay, so these are all the important contents. Along with it, you will have the fat pad here, so that is a popliteal fat pad, and you will also have popliteal lymph nodes. In this. Okay, you will have popliteal lymph nodes in this. So these are the contents of the popliteal fossa. Okay, so the popliteal artery, popliteal vein, tibial nerve, common peroneal nerve, and the popliteal lymph nodes are the important contents here. Okay, so please remember about popliteal fossa. When you remember popliteal fossa, please remember about the floor of the popliteal fossa. Questions have come in that area. You should know what is called as an oblique popliteal ligament. Okay, you should know about the oblique popliteal ligament. Okay, so keeping this in mind, we will go to the next topic. Okay, so I think you are clear with popliteal fossa. Okay, if I want to add an applied aspect to the popliteal fossa, yes, anybody, which artery pulsation is seen in the popliteal fossa? Yes, popliteal artery pulsation can be seen in the popliteal fossa. It is a deeply placed vessel there, so you need to flex the knee. Okay, when you are going to palpate the popliteal artery, you need to flex the knee, you need to relax the popliteal fossa to look for the popliteal artery. Otherwise, it is very difficult to feel the popliteal artery, because popliteal artery is the deeper structure in this, is the deeper structure in this. Okay, now can anybody tell me what is the joint which is related to the popliteal fossa? This is like a simple question what they ask in Kaun Banega Crorepati. So it is like what is the joint which is related to popliteal fossa, guys? It is a very simple question. I think everyone should answer for this. It is knee joint. Yes, very good. It is knee joint. Very good, guys. It is knee joint. But what is important here is knee joint is one joint where dislocations can happen. Okay, when dislocation is happen, you can see the popliteal artery running very close to the knee joint. So in a knee joint dislocation, okay, in a knee joint dislocation, this popliteal artery is commonly affected. Popliteal artery thrombosis can happen. Popliteal artery thrombosis can happen. So please be aware, whenever a patient presents with a knee joint dislocation, you should check for the distal pulse. You should look for whether there is any popliteal artery thrombosis is not there or not. This is one important point. Next is for any dislocation for that matter, it is associated with nerve injuries. See, for example, shoulder dislocation is associated with what? Shoulder dislocation is associated with axillary nerve injury. Similarly, here knee joint dislocation is associated with anybody, guys. What is the nerve commonly affected when there is a knee joint dislocation? I hope these questions, if you crossed orthopedics, you would have studied this. So what is the nerve which is affected when there is a knee joint dislocation? The nerve which is affected in knee joint dislocation is common peroneal nerve. Is common. Very good Muga. It is common peroneal nerve, guys. It is common peroneal nerve. And always remember, when there is a common peroneal nerve palsy, the patient will present to you with foot drop. Okay, since we have talked about dislocation, okay, few things about dislocation, just you can write this. The dislocation where the nerves are affected, the shoulder dislocation, okay, shoulder dislocation, it causes axillary nerve injury. Okay, it causes axillary nerve injury. Axillary nerve is affected here. So in dislocation, what are the nerves that are affected? We are seeing. So in shoulder dislocation, you get axillary nerve injury. Okay, and there is a dislocation around the elbow, that is called as elbow dislocation. In elbow dislocation, what is the nerve that is affected? The ulnar nerve is affected in elbow dislocation, guys. Ulnar nerve is affected in elbow dislocation. Okay, ulnar nerve is affected in elbow dislocation. Okay, there is a dislocation called as Monteggia dislocation. There is a dislocation called as Monteggia fracture dislocation. Okay, in Monteggia fracture dislocation, the proximal radial nerve joint gets dislocated. So in Monteggia fracture dislocation, you will have posterior interosseous nerve palsy. Okay, posterior interosseous nerve palsy can happen in Monteggia fracture dislocation. Whenever there is a lunate dislocation, yes, guys, answer is very simple. You should answer this. I am answering for all the questions. Lunate dislocation. What is the nerve that is affected in lunate dislocation? What is the nerve that runs in front of the lunate through the carpal tunnel, resulting in carpal tunnel syndrome, guys? Yes, very good, Vinita. It is the median nerve. Median nerve gets affected whenever there is a lunate dislocation, whenever there is a posterior hip dislocation. I hope you know this. There is an important nerve runs in the posterior aspect of the hip, that is the sciatic nerve. Okay, next nerve which is affected in anterior hip dislocation. Is, okay, the nerve which is affected in anterior hip dislocation is femoral nerve. Guys, it is femoral nerve. Okay, and the nerve which is affected in knee dislocation is, yes, it is the common peroneal nerve. These are common dislocations which we see in our clinical practice, and whenever there is dislocation, you have got these kind of associated nerve injuries along with the dislocation. So that is why what they say is dislocations are called as surgical emergencies. Okay, they are called as surgical emergencies. You need to reduce the dislocation as early as possible. When you don't reduce the dislocation, it can cause so much of nerve palsy. So any dislocation, it is a surgical emergency. We consider that as a surgical emergency. Okay, so we need to treat it as early as possible. So I think we were discussing about the popliteal fossa. We were discussing about the boundaries of the popliteal fossa. We were discussing about the contents on the roof and the floor. I think we are done with it. We are going to the next important region, that is the gluteal region. Okay, see, gluteal region, a lot of questions can come from this area. This is a potential area, so we'll just see what is happening in the gluteal region. So if you want to understand the gluteal region, okay, one simple thing is you need to refresh this diagram. This diagram is nothing but the gluteal surface of the hip bone. Okay, this is nothing but the gluteal surface of the hip bone. This is the posterior superior iliac spine, and this is the anterior superior iliac spine. You get the posterior inferior iliac spine, and you get a notch here. This is the greater sciatic notch. This is the ischial spine. This is the lesser sciatic notch. This is the ischium and the conjoint ischiopubic rami. Then you get the anterior inferior iliac spine. Then you get the iliopubic eminence and the body of the pubis, and you get a foramen here. This foramen is called as obturator foramen, and you get a cup-like cavity which is called as acetabulum, We have seen all these, guys. In the morning we have seen all this, and there are three lines which are lining. One is called as posterior gluteal line, one is called as an anterior gluteal line, another one is called as an inferior gluteal line. You have got three lines which are dividing this area, and there is a bone which articulates with the acetabulum, that is the hip joint. So what I am going to do is I am going to remove the femur from the hip joint. I am going to keep it by the side of the hip bone. So I am going to take the femur out, and I am going to keep it here. Okay, I am going to keep it here. Okay, so I am going to keep it here. Okay, so this is the posterior view of the femur. Why I say this is a posterior view? Because I see a crest. What is this crest called as? This crest is called as the intertrochanteric crest. When I see the intertrochanteric crest, okay, okay, so that is the posterior view of the femur. So when I see the intertrochanteric crest, that is the posterior view of the femur. Okay, so if you see this gluteal surface, as we have seen, there are several lines here, and these lines will help in understanding the muscles in this area. Okay, so the big muscle which is covering the gluteal region is the gluteus maximus muscle. I hope you know there is a bone which is here. Okay, there is a bone which is here. What is the bone that articulates with the pelvic bone here, or the ilium bone here? This bone, which is triangular in shape, is nothing but the sacrum bone, and the sacrum has got connected with coccyx bone here. Okay, I hope you also know that there is a ligament which is extending from the sacrum and the iliac region to the ischium, which is called as a sacrotuberous ligament. So what is this ligament called as? This ligament is called as a sacrotuberous ligament. So this is about the important things you need to know in this. Now first muscle is the gluteus maximus muscle, guys. First muscle is called as gluteus maximus muscle. Now where is this gluteus maximus muscle takes place? It takes origin from the gluteal surface of the ilium behind the posterior gluteal line. Now what is this line called as? This line is called as posterior gluteal line, and just behind the posterior gluteal line on the gluteal surface, this muscle takes origin. So this is the origin of the gluteus maximus muscle. It not only takes origin from here, it takes also origin from the sacrum, and it also takes origin from the sacrotuberous ligament. Okay, so gluteus maximus is here. Okay, so what is the origin of the gluteus maximus? Gluteus maximus takes origin from the gluteal surface. It takes origin from the gluteal surface of the ilium. Where it is? It is behind the posterior gluteal line. Okay, and it also takes origin from the sacrum and also from the sacrotuberous ligament. It has got a wide origin, guys. Okay, it takes origin from these structures. And where does it get inserted? If you see the gluteus maximus muscle, the gluteus maximus muscle goes and gets inserted into this band which is present on the lateral aspect of the thigh. Yes, anybody? What is the band which is present on the lateral aspect of the thigh called as? The fascia lata on the lateral side of the thigh thickens and forms a tract. Very good, Anashwara. It is the iliotibial tract. It is not iliopubic tract, Muga. It is iliotibial tract. Okay, so if you see here, So there is an spiral line, it is running here, which is called as a pectineal line forming the linea aspera. Similarly, on the lateral side, the linea aspera thickens to form a tuberosity called as gluteal tuberosity. So there is a tract which is running here. This tract is called as the iliotibial tract. So what is this tract called as? This tract is called as iliotibial tract. Okay, so this tract is called as the iliotibial tract. Okay, iliotibial tract. Okay, and this tuberosity what you see here, is the gluteal tuberosity. It is called as a gluteal tuberosity, like deltoid tuberosity. This is called as gluteal tuberosity, and this gluteus maximus muscle gets attached in this area, and it is attached also to this area. So if somebody asks you what is the insertion of gluteus maximus, if somebody asks you what is the insertion of gluteus maximus, okay, what is the insertion of gluteus maximus? If somebody asks you, gluteus maximus is inserted into gluteal tuberosity. It is getting inserted into gluteal tuberosity, and it is also getting inserted into the iliotibial tract. It is called as an IT band or an iliotibial tract. We call it as an IT band or an iliotibial tract. Okay, so this is about the origin and insertion of the gluteus maximus, guys. It is about the origin and insertion of the gluteus maximus. Whenever there is a muscle, you should know about the nerve supply of the muscle. So nerve supply for this muscle is, okay, nerve supply for this muscle is by inferior gluteal nerve. It is by the inferior gluteal nerve. Okay, so gluteus maximus nerve supply is by the inferior gluteal nerve. It is by the inferior gluteal nerve. Clear? So gluteus maximus is supplied by inferior gluteal nerve. What is the action of the gluteus maximus, guys? Okay, it is the main extensor of the hip joint. Always remember, guys, in the hip joint, if a muscle is causing extension, it will also cause lateral rotation of the hip joint. So extensors are usually lateral rotators. Extensors are usually lateral rotators. So always remember, gluteus maximus, if it is a muscle which causes extension, it is a main muscle which causes extension. Okay, so this muscle helps in not only extension of the hip, but also helps in lateral rotation of the hip joint. Okay, so this is about the gluteus maximus. See, gluteus maximus is a muscle which helps you from getting up in a sitting position. Okay, yes, we are back again. We were discussing about the gluteus maximus, guys. So gluteus maximus, the nerve supply for gluteus maximus is inferior gluteal nerve. Okay, the root value for inferior gluteal nerve is L5, S1 and S2. This is the root value for inferior gluteal nerve. Okay, and also remember, it causes extension of the hip joint. So whenever a muscle causes extension of the hip joint, that will also act as the lateral rotator of the hip joint. Okay, so these are all the actions of the gluteus maximus. And also remember, if a person has to get up from a sitting posture, if a person is sitting in the floor, and if he has to get up from the floor, gluteus maximus is the main muscle which helps in that. Okay, if the gluteus maximus doesn't work, then the patient will climb on himself. Okay, he will hold the knee and will slowly get up. So gluteus maximus muscle is a main muscle which helps you from getting up when you sit in a floor. Okay, so that is the importance of gluteus maximus muscle. Okay, so the next muscle what you see here is, so the gluteus medius muscle. Now when you remove the gluteus maximus, you see lot of muscles underneath the gluteus maximus. So the first muscle what you see here is the gluteus medius muscle. Now gluteus medius muscle is seen in the region between the anterior gluteal line and the posterior gluteal line. So this is the area where you see the gluteus medius muscle. So what is this line called as? This line is called as the anterior gluteal line. Okay, and this muscle which is present between the anterior gluteal line and posterior gluteal line is called as the gluteus medius muscle. Okay, so this muscle is called as gluteus medius muscle. Okay, so if you see gluteus medius muscle here, okay, you should know where it gets inserted. This is the origin of the gluteus medius. The gluteus medius muscle goes and gets attached to the anterolateral aspect of the greater trochanter. So this is the area where the gluteus maximus medius muscle gets attached. So what is this? This is the insertion of gluteus medius muscle. Okay, so if you talk about gluteus medius muscle, so gluteus medius muscle takes origin between the anterior gluteal line and the posterior gluteal line, and where it gets inserted, it goes and gets inserted into the anterolateral aspect of the greater trochanter. Anterolateral aspect of the greater trochanter. Okay, see, more than this attachments, the nerve supply and the actions are very important. The nerve supply and the actions are very important. Okay, what is the nerve supply for gluteus medius muscle? So the nerve supply for gluteus medius muscle is by superior gluteal nerve. It is by the superior gluteal nerve. It has got root value L4, okay, L5 and S1. It has got root value L4, L5 and S1. This is by superior gluteal nerve. This is by superior gluteal nerve. Okay, this is by superior gluteal nerve. Okay, so gluteus medius is the main abductor of the hip joint. So this is the main action. What is the action of the gluteus medius, guys? It is the main abductor of the hip joint. It is the main abductor of the hip joint. It is the main abductor of the hip joint. Clear, guys? Clear? So this is the main abductor of the hip joint. Okay, so this gluteus medius also has another function, that is the medial rotator of the hip joint. So always remember, if a muscle is an abductor of the hip joint, it will also cause medial rotation. So the medial rotation of the hip joint is also caused by this muscle. This muscle is gluteus medius muscle. So gluteus medius muscle is supplied by superior gluteal nerve. It has got two important action. One is called as an abduction of the hip, another one is called as a medial rotation of the hip. Okay, very important, guys, when you walk. Okay, when you walk, only when the gluteus medius works, the hip will be cleared off the ground. So you will be able to lift the hip away from the ground only when the gluteus medius muscle acts. We will just discuss about that in a short while by drawing a simple diagram so that you can easily understand that. Before going into that, we will also look into another abductor of the hip joint. The another abductor of the hip joint is gluteus minimus muscle. Now where is this minimus muscle? I will use a different color here. The minimus muscle arises between the inferior gluteal line and the anterior gluteal line. Now what is this line called as? This line is called as the inferior gluteal line. So this muscle takes its origin from the area between the inferior gluteal line and the anterior gluteal line. So what is this muscle called as? This muscle is called as the gluteus minimus muscle. This is called as gluteus minimus muscle. And where is this muscle attached? This muscle is attached more to the anterior aspect of the greater trochanter. It is again attached to the greater trochanter. Okay, it is again attached to the greater trochanter. To which part of the greater trochanter? More to the anterior aspect of the greater trochanter. Okay, so origin and insertion is not that much important, guys. Just you understand, gluteus medius goes and gets attached to the anterolateral aspect of the greater trochanter. Gluteus minimus getting attached, inserted into the anterior aspect of the greater trochanter. Now what is the nerve supply and action of this muscle? Okay, what is the nerve supply and action of this muscle? So gluteus minimus, if you see, it is supplied by same superior gluteal nerve, which has got root value L4, L5 and S1. It is by superior gluteal nerve, and the action is same. As the gluteus medius muscle. Okay, it is same as gluteus medius muscle. It is same as the gluteus medius, which means it is going to abduct your hip joint, and it is also going to help in medial rotation of the hip joint. It also helps in medial rotation of the hip joint. Okay, so this is a question which was asked in the NEET exams. They have given the proximal femur. Okay, they have given a proximal femur, and they have shaded this area, and they asked you what is the muscle which is attached to this area. What is the muscle that is attached to this area? Can anybody tell me what is the muscle which is attached to the area? You can see the shaded area is involving the anterior and also the lateral aspect of the greater trochanter. So what is the muscle that is inserted into the anterolateral aspect of the greater trochanter? Excellent, guys. Excellent, Soumya, Anashwara and Muga, everybody. Yes, very good, guys. It is gluteus medius. It is Gluteus medius, guys. Yes, gluteus medius main function is abductor of the hip joint. Is abductor of the hip joint. So what is called as an abduction? When you are going to lift your limb away from the ground, it is called as abduction. Okay, so when you are moving it away from the ground, it is called as an abduction. Okay, so now what is this muscle doing and how this muscle helps in abduction? Just we'll draw a simple diagram to understand this. See, if you take as we'll just draw it here. Okay, if you take a small fulcrum with a lever attached to it, okay. Okay, now let us consider I am putting a weight here. Okay, I am putting a weight here. So this is the weight which is being suspended on one side. Now I want my weight to go up. Okay, if this weight has to go up, on which side of the lever should I pull down? Okay, so you can see that I have to pull down from the opposite side, guys. Isn't it or not? I have to pull down from the opposite side, guys. So I have to put a rope here and I have to pull down from the opposite side. Okay, so only when I pull down from the opposite side, this side the weight will go up. Okay, isn't it or not? So what I'm going to replace this lever is, I'm going to replace this lever with the following bones. Okay, so I'm just going to turn this lever. Okay, turn this fulcrum on the lever. So this is a bone which is present in the body like this, and this is a bone which is present in the body like this. Okay, okay, fine. So this is the sacrum bone. Okay, this is the sacrum. Okay, and this is the hip bone. This is the hip bone. And what is this? This is the weight of the lower limb. This is the weight of the lower limb. Okay, if the lower limb on the opposite side, if it has to go up, what is the muscle that acts on the other side? The muscle which acts on the other side is the gluteus medius and gluteus minimus. Okay, so when gluteus medius and gluteus minimus on the opposite side acts, the weight of my opposite side limb will go upwards. So if you want to clear the left hip away from the ground, so please be clear, guys. Very important concept. Lot of questions, many times this question had come down. If you want to clear the left limb off the ground, if you want to lift your left limb off the ground, what is the muscle which is acting? The muscle is acting on the right side of the pelvis. The muscle is acting on the right side of the pelvis. And what is the muscle which is acting on the right side of the pelvis? Tilting the fulcrum. So this is gluteus medius and minimus. And what is the nerve supply for this? It is by superior gluteal nerve. So what do they infer this? What is the inference from this? If there is a superior gluteal nerve injury, or if there is a condition like poliomyelitis, where gluteus medius and gluteus minimus muscles are not working, what happens is you cannot lift the opposite side limb. That test is called as Trendelenburg test. So that test is called as what? Trendelenburg test. You can see this picture. Okay, you can see in this picture. Okay, so A is the normal side and B is the abnormal side. Okay, what is doing is, when the patient is lifting the lower limb on one side, the pelvis tries to stabilize by the pull of this muscle, that is the gluteus medius and gluteus minimus muscle. But if the muscle is not working, okay, the weight of the limb cannot be lifted, so the pelvis droops to that side. So this test is called as what? Trendelenburg test. This test is called as Trendelenburg test. Okay, this test is called as Trendelenburg test. Trendelenburg test is also used in checking one more condition, okay, which comes in general surgery. Trendelenburg test or Trendelenburg sign. Where do you get Trendelenburg test or Trendelenburg sign in general surgery, guys? To see the varicose veins, okay, to see the patency of the veins. Yes, very good, Radhika, Soumya, very good. So to see the varicose veins, you do the Trendelenburg test there. But in orthopedics, Trendelenburg test is used to check these two muscles. One is gluteus medius muscle and another one is gluteus minimus muscle. Okay, another one is gluteus minimus muscle. Okay, and what is the nerve supply? So the nerve supply for this muscle is superior gluteal nerve. So they are checking the superior gluteal nerve. Okay, so if the patient is not able to lift his left hip, what is the muscle which is not working? Is right side gluteus medius and minimus is not working. If the patient is not able to lift his right hip, the left side gluteus medius and minimus are not working. This is a very important take home message. Okay, if you understand this, every year at least one question comes in this area. So please be clear in the gluteus medius minimus muscle. Okay, so if the gluteus minimus and the gluteus medius doesn't work, it results in a gait called as lurching gait. It results in a gait called as lurching gait. If one side gluteus medius minimus, unilateral gluteus medius weakness, unilateral gluteus medius weakness will result in a gait called as lurching gait, whereas bilateral gluteus medius weakness, bilateral gluteus medius weakness will result in a gait called as waddling gait, will result in a gait called as waddling gait. Okay, this gait is also an important topic in the lower limb. Okay, so lurching gait is seen in unilateral gluteus medius weakness. Bilateral gluteus medius weakness will result in a gait called as waddling gait. So they will walk like this, they will walk like this. Okay, either side the shoulder will dip, so that is called as waddling gait. If one side the shoulder dips, that is called as lurching gait, that is called as lurching gait. I'll just add one more gait here, since we are talking about gait. There is a gait called as scissoring gait. There is a gait called as scissoring gait. Can anybody tell me scissoring gait is seen where? In which condition scissoring gait can be seen? Or very good, Soumya. It is seen in cerebral palsy. It is seen in cerebral palsy. It is seen in cerebral palsy. So whenever a patient walks, you should look at his shoulder. When one shoulder dips, okay, that is called as lurching gait. When both the shoulders dip, dips like this, then that is called as waddling gait. That is called as waddling gait. Okay, that is called as waddling gait. Okay, so there is another gait called as an high stepping gait. Can anybody tell me high stepping gait is seen where? High stepping gait. Yes guys, high stepping gait. Very good. It is seen in foot drop. It is seen in foot drop, guys. It is seen in foot drop. High stepping gait is seen in foot drop. Excellent, guys. Excellent, Hari. So this is about the gluteus medius and gluteus minimus muscle, guys. Very, very important high yield area. Okay, so please have a look into it. Okay, fine. So this is about the muscles which are seen in the gluteal region. Now I know that we have completed the gluteus medius, minimus, and the gluteus maximus muscle. Okay, the next muscle to be seen in this area is, can anybody tell me what is the muscle which is seen in this area? I am just drawing a red color in this area. Can anybody tell me what is the muscle? We have discussed about the muscle in the morning session, that is rectus femoris. Yes, very good, Anashwara. But what head of rectus femoris? We have got two heads of rectus femoris. It is a reflected head of rectus femoris. Very good, excellent, guys. So from the area above the acetabulum, you get the reflected head of rectus femoris. Now from the pelvic bone, okay, from the anterior surface of the sacrum, okay, from the anterior surface of the middle three pieces of the sacrum, from the anterior surface of the middle three pieces of the sacrum, okay, I'll just use a blue color again here. From the anterior surface of the middle three pieces of the sacrum, there is a muscle which comes out of the pelvic cavity through the greater sciatic foramen, and this muscle which comes out of the greater sciatic foramen here. Okay, there is only one muscle which comes out of the greater sciatic foramen, and the muscle which comes out of the greater sciatic foramen, which is arising from the middle three pieces of the sacrum from the anterior surface of the sacrum, is nothing but the piriformis muscle. What is this muscle called as? This muscle, what you see here, is called as the piriformis muscle. This is called as a piriformis muscle. This is called as a piriformis muscle, and this piriformis muscle goes and gets inserted into a fossa here, which is called as piriform fossa. So there is a fossa here which is called as piriform fossa. There is a fossa which is called as piriform fossa, where this muscle gets attached. So piriform fossa is located where? It is located on the medial side of the greater trochanter. It is located on the medial side of the greater trochanter. So it is where this muscle gets inserted into. Okay, so this is about the piriformis muscle. Okay, so piriformis muscle supplied by the roots of S1 and S2. Okay, it is supplied by the roots of the S1 and S2. So we'll just write here. Okay, so piriformis muscle. So piriformis muscle, okay, supplies by roots of S1 and S2. Okay, it is supplied by roots of S1 and S2. So this muscle is an lateral rotator of the hip joint. Okay, so we will go to the next muscle in this area. Other muscles are small muscles. Now one muscle which arises from the ischial spine. Okay, one muscle that arises from the ischial spine, is this muscle which is called as the superior gemli, and there is a muscle which takes origin from the inner aspect of the obturator membrane, okay, from the inner aspect of the obturator membrane, and it comes out as a tendon, and this tendon is called as an obturator internus tendon. This tendon is called as an obturator internus tendon. On the upper part of the ischium there is another muscle which arises, so this muscle is called as the gemellus inferior. So don't worry about, guys, don't worry about the origin of these muscles, insertion of these muscles, not much needed. You need to understand that there are three muscles in this region. One is called as superior gemli. So this is called as what? This is called as superior gemli. This is called as superior gemli. Next there is a tendon which is called as obturator internus tendon, obturator internus tendon, and next comes an gemli. This is called as inferior gemli. This is called as inferior gemli. Now I got three muscles in this area. One is called as the superior gemli, the obturator internus, and the inferior gemli. These three muscles join to form a common tendon that is called as tricipital tendon. So they form a common tendon. They form a common tendon called as tricipital tendon. Okay, they form a common tendon called as tricipital tendon. Okay, they form a common tendon called as tricipital tendon, and they go and gets attached to the medial side of the greater trochanter here. Okay, so they go and gets attached in this area. They go and gets attached to the medial side of the greater trochanter. They go and gets attached on the, okay, they go and get attached on the medial side of the greater trochanter in this area. Okay, in this area it goes and gets attached. So this is the tricipital tendon formed by superior gemli, formed by the obturator internus, and formed by the inferior gemli. Okay, so we'll write those muscles here. We'll write those muscles here. One is the superior gemli. One is the superior gemli. Next is the obturator. Next is the obturator internus. Next is the obturator internus. Next is the inferior gemli. All these muscles, okay, all these muscles are again lateral rotators of the hip joint or lateral rotators of the thigh. So piriformis, superior gemli, obturator internus, inferior gemli are all lateral rotators of the hip region, or all lateral rotators of the hip or thigh region. What is their nerve supply? Both these muscles are supplied by nerve to obturator internus. Nerve to obturator internus is the nerve supply of these muscles. Okay, just below the inferior gemli, just below the inferior gemli, there is another muscle which takes origin. The next muscle which takes origin from this area is the quadratus femoris muscle from the ischium bone. From the lateral aspect of the body of the ischium, you get another muscle taking its origin. So that muscle is called as the quadratus femoris muscle. So that muscle is called as quadratus femoris muscle. So this quadratus femoris muscle and the inferior gemli are all supplied by nerve to quadratus femoris, are all supplied by nerve to quadratus femoris. Okay, fine. So this is supplied by nerve to quadratus femoris. So superior gemli and obturator internus are supplied by nerve to obturator internus. Inferior gemli and quadratus femoris are supplied by nerve to quadratus femoris. Nerve to quadratus femoris. Nerve to quadratus femoris. If you see the diagram here, you can able to identify these muscles now. Now can anybody identify what is the muscle C represents? What is the muscle C represents? The muscle C represents, they have already given, it is gluteus minimus. Yes, this is piriformis. Yes, accepted. Now tell me, what is this muscle? Okay, what is the muscle 1 represents? Anybody? What is the muscle 1 represents? This muscle 1 arises from the ischial spine. What is this muscle? Yes, it is superior gemli, guys. It is superior gemli. What is the next muscle which is seen in this area? What is the next muscle which is seen in this area? Below the superior gemli is a tendon of the obturator internus muscle. So it is obturator internus muscle. It is obturator internus muscle. The one which is seen below is nothing but the inferior gemli. Okay, is nothing but the inferior. So these three muscles, they form a common tendon which is called as a tricipital tendon. Okay, now there is a muscle which is running in an horizontal direction. This is the last muscle in the gluteal region to run in an horizontal direction. Below that everything will run vertically. Below that everything will run vertically. So what is this muscle? This muscle which is running in a horizontal direction here is called as the quadratus femoris muscle. Is called as the quadratus femoris muscle. Is called as the quadratus femoris muscle. Remember guys, all these small muscles in this area, superior gemli, piriformis, superior gemli, Okay, piriformis. No guys, no Anashwara, it is not. See, they only piriformis takes origin from the pelvic surface. Okay, all the other muscles takes origin from the gluteal surface only. Okay, all the other muscles takes origin from the gluteal surface. So remember that only the muscle which comes out of the pelvis, which takes origin from inside the pelvis, is piriformis and obturator internus. Okay, other muscles, superior gemini, inferior gemini, quadratus femoris, they take origin outside the pelvis, they take origin from the gluteal surface. Okay, so only two muscles takes origin from within the pelvis. One is piriformis, another one is obturator internus muscle. Anashwara, are you clear with this? Okay, there are two muscles which takes origin from within the pelvic surface, okay, or inside the pelvis. One is piriformis, another one is obturator internus. Superior gemini, inferior gemini, quadratus femoris takes origin from the gluteal surface, okay. So now if you see this, these muscles are called as the lateral rotators. These muscles are called as the lateral rotators of the thigh, or the lateral rotators of the hip joint, lateral rotators of the thigh or lateral rotators of the hip joint. Okay, so fine, I think we have done with the lateral rotators here, and we have done with the nerve supply also here. We have seen about the nerve supply. I hope you are clear with this, guys. Okay, fine. See, when you see this okay, when you see this area, okay, lot of important other structures also runs in this area. So to highlight a few of them here, okay, so you can see a muscle called as piriformis. Here. If a nerve arises from the superior aspect of the piriformis, this nerve will be superior gluteal nerve. Guys, remember, superior gluteal nerve, okay, supplies three muscles. Can anybody tell me what are the three muscles which are supplied by superior gluteal nerve, guys? What are the three muscles which are supplied by superior gluteal nerve? Yes, one is gluteus medius, very good. Next one is gluteus minimus, yes, very good. What is the third muscle which is supplied by superior gluteal nerve? There is one more muscle which is supplied by superior gluteal nerve. Anybody? Yes, I am waiting for the answer, guys. I didn't told about this muscle, I kept it as a secret. Okay, so I want to reveal the secret now. So one muscle which is also supplied by superior gluteal nerve is tensor fascia lata. So there is a muscle called as tensor fascia lata. Okay, so that muscle takes origin from here. Okay, that muscle takes origin from the iliac crest, from the anterior 5 cm of the iliac crest. The tensor fascia lata muscle takes its origin. So please remember, superior gluteal nerve, it gives nerve supply for gluteus medius, it gives nerve supply for gluteus minimus, and it also gives nerve supply for tensor fascia lata. Okay, it gives nerve supply for tensor fascia lata. Okay, so please remember the superior gluteal nerve. If you see the piriformis muscle, okay, you see the superior border, you see this nerve, superior gluteal nerve. When you see the inferior border of the piriformis, you see bunch of nerves here. Okay, the one nerve which is very thick, and it is cut here. Okay, so they have cut the nerve. And what is this important nerve that runs below the piriformis muscle? It is the thick nerve it is the thickest nerve of the body which runs below the piriformis, guys. So this nerve which you see here is the sciatic nerve. Yes, guys, it is sciatic nerve. Very good, guys, it is sciatic nerve. Okay, sciatic nerve, just medial to the sciatic nerve, okay, you get another bunch of nerve which is supplying the gluteus maximus muscle. This nerve which is supplying the gluteus maximus muscle is the inferior gluteal nerve. This is called as the inferior gluteal nerve. And when you see the structure close to the inferior gluteal nerve, there are some structure which are winding around this ischial spine. I just want you to understand that. For that I am going to draw a simple diagram again, and that will help you to identify this area and understand this area easily. Okay, so this is again the greater sciatic notch, this is the ischial spine, and this is the lesser sciatic notch. Okay, so this is the ischium bone. I hope you know that there is a ligament which is attached to the ischial spine. This ligament which is attached to the ischial spine is called as what? This is called as the sacrospinous ligament. This is called as sacrospinous spinous ligament. This is called a sacrospinous ligament. Now there is a muscle which comes out of the greater sciatic notch, that is the piriformis muscle. That is the piriformis muscle. Now there is a nerve. Okay, so I will just use this purple color for the nerve here. So there is a nerve which comes out of the pelvic cavity, winds around the ischium and re-enters the pelvic cavity like this, and re-enters the pelvic cavity like this. Okay, so there is a nerve which comes out of the pelvic cavity, winds around the ischial spine, and they re-enter the pelvic cavity again. Okay, they re-enter the pelvic cavity again. There is one more artery which is doing like that. The artery runs out of the pelvic cavity, winds around the ischial spine, and they again run into the pelvic cavity. There is one more nerve, okay, which is running out of the pelvic cavity, then they run again into the pelvic cavity. So this structure which are winding around the ischial spine, returning back into the pelvic cavity, are called as the pin structures. They are called as the pin structures. What are these pin structures stands for? P stands for pudendal nerve, Q stands for pudendal nerve, I stands for internal pudendal vessels, I stands for internal pudendal vessels, and N stands for nerve to obturator internus. Nerve to obturator internus, very very important question. Sometimes they will put an ischial spine, they will put an arrow here, they can ask you what is the structure here. So these three structures, they come out of the pelvic cavity, winds around the ischial spine, through the lesser sciatic foramen they re-enter into the pelvic cavity. So these three nerves are called as the pin structures. Pin structures, P stands for pudendal nerve, I stands for internal pudendal vessels, and N stands for obturator. Now N stands for nerve to obturator internus. N stands for nerve to obturator internus. So pin structures is an important question here, guys. Pin structure is an important here. So these are the three structures, the two nerves, the vessels, they haven't put it here. So the two nerves which are re-entering are, the one is the pudendal nerve, another one is the nerve to obturator internus. You can see the pudendal nerve coming and supplying the pudendal region, that is the genital region, and to the anal region, we'll just discuss those things in detail when we come to the perineal region. Okay, so as for now, just have this things in your mind. Okay, so just below the piriformis, okay, just below the piriformis, you have seen lot of structures. One, you saw the sciatic nerve, then you saw the inferior gluteal nerve, then you saw the pudendal nerve, internal pudendal vessels, and the nerve to obturator internus, and last nerve which is running down to the thigh. Okay, you can see a nerve which is running to the thigh here. This nerve is called as a posterior, femoral cutaneous nerve of the thigh. This is called as posterior femoral cutaneous nerve of the thigh, which supplies the posterior aspect of the thigh, which supplies the skin of the posterior aspect of the thigh, and these are the structures which are present in this area. I hope you are clear with this picture. This pictures, see, nowadays image based questions they ask very frequently. Okay, so they put an arrow mark in any one of this, and they might ask you what is the structure or what are the muscles which are supplied by this nerve. So they can ask frame questions like this. So that is why we put this picture and we were discussing about this. So when you talk about gluteal surface of the ilium, you got lot of muscles. The main key muscle, if somebody asks you what is the key muscle of this region, okay, if somebody asks you what is the key muscle, okay, of this region, can anybody tell me what is the key muscle of the gluteal region? Key muscle of the gluteal region. Yes, guys, anybody? Okay, what is the key muscle of the gluteal region? Yes, it is piriformis. Very good, Anashwara, it is piriformis. It is based on the piriformis we classify the structures above piriformis and structure below the piriformis. So piriformis is the key muscle of this region. It is the key muscle of this region. Very good, guys. And always remember, the abductors are medial rotators, the extensors are the lateral rotators. So gluteus maximus is an extensor and a lateral rotator. Gluteus medius and minimus are abductors and medial rotators. Okay, abductors and medial rotators. So we were discussing about these muscles. Now I hope you understood this clinical implication. So they palpate the ischial spine and they block a nerve. Okay, so they are palpating a ischial spine, and just now we saw a nerve is winding around the ischial spine. And what is this nerve? The nerve which is winding around the ischial spine is pudendal nerve. So this is called as pudendal. This is called as a pudendal nerve block. This is called as a pudendal nerve block. Okay, so to reduce the pain during parturition, okay, during delivery time, to reduce the pain, because when the lower urogenital region, when it stretches, causes severe pain. So to reduce the pain, so they give this block. This is called as a pudendal nerve block. So to identify the pudendal nerve or to block the pudendal nerve, you should know the bony landmark for it. The bony landmark for it is that ischial spine, okay. So they block the pudendal nerve close to the ischial spine, guys, okay. So this is about the gluteal surface, okay. So with this we will move to the next part of the thigh, that is the hamstring muscles, okay. So I hope you know what is called as the hamstring muscles, okay. So the hamstring region, so the muscle and the posterior aspect of the thigh is called as an hamstring muscles. The muscles in the posterior region of the thigh is called as an hamstring muscles, okay. If you take the posterior compartment of the thigh, again the nerve of the posterior compartment of the thigh is sciatic nerve, the nerve of the posterior compartment of the thigh. So hamstring muscle, if you see, where is they are located? They are located in the posterior compartment. They are present in the posterior compartment. They are present in the posterior compartment of the thigh. And what is the nerve of the posterior compartment of the thigh? The nerve of the posterior compartment of the thigh is sciatic nerve. It is sciatic nerve, guys. It is sciatic nerve, okay. See, when you talk about the hamstring muscles, okay, there are 4 hamstring muscles, okay. So what are those 4 hamstring muscles? One is called a semimembranosus. Semimembranosus. The next muscle is called as, okay, so the next muscle is called as semitendinosus. So the next muscle is called as semitendinosus. This is called as semitendinosus, okay. So this muscle is called as semitendinosus, okay. So the next muscle what you see in this region is biceps femoris, and the 4th muscle which is called as an hamstring muscle is called as the hamstring part of adductor magnus muscle. Is the hamstring part of adductor magnus muscle. It is the hamstring part of adductor magnus muscle, okay. So you got 4 muscles in this region. One is called as semimembranosus, another one is called as semitendinosus, biceps femoris. As you know, biceps means it is 2, so it has got 2 heads. The next is the hamstring part of the adductor magnus. Next is called as the hamstring part of the adductor magnus, guys, okay. These are the muscles of the hamstring region, and these muscles, they carry a common characteristics, okay. So they have got a common characteristics. All these muscles, if you see, they all arise from the ischial tuberosity. So this region is called as the ischial tuberosity, okay. So this region is called as the ischial tuberosity, okay. So this is called as an ischial tuberosity. So all this muscle arises from this ischial tuberosity. Guys, okay. So that is one common feature of this hamstring muscle, and all these muscles are inserted into one of the bones of the leg. They don't get inserted into the thigh bone, they don't get inserted into the femur. They cross the knee joint, and they get inserted into the one of the bones of the leg. So they act on the knee joint, okay. So they cause flexion of the knee. So since they are on the posterior aspect, when they contract, they cause flexion of the knee, okay. So these muscles causes flexion of the knee. In addition, they are weak extensors of the hip joint. Okay. So this muscle, okay, since it crosses the knee, they are the chief flexors of the knee joint, and they are weak extensors of the knee joint. And all these are supplied by sciatic nerve, okay. Okay, especially by the tibial part, except one small part of the muscle, okay, so all these are supplied by the tibial part of sciatic nerve. We'll just see one by one what is this muscle doing, where is they getting inserted, okay. The first muscle in this is biceps femoris, okay. So this biceps femoris, as we know, it has got origin from ischial tuberosity, okay. So the origin point of biceps femoris is ischial tuberosity. For all the hamstring muscles, the origin is from ischial tuberosity. As we have discussed, biceps femoris has got 2 heads. One is called as a long head, another one is called as a short head. One is called as a long head, another one is called as a short head. Okay, one is called as a long head, another is called as a short head. This long head arises from the ischial tuberosity. This long head arises from the ischial tuberosity as you are seeing in the picture, whereas the short head arises from the shaft of the femur. It is arising from the shaft of the femur. Okay, it is arising from the shaft of the femur. Both of them. So this is the origin of biceps femoris, and they get inserted into, where do they get inserted? The insertion. Okay, they get inserted into, these two heads fuse and they get inserted into the head of the fibula. They are getting inserted into the head of the fibula. Okay, they are getting inserted into the head of the fibula. You can see the insertion of the biceps femoris over the head of the fibula here. Head of the fibula here. Okay, fine. So this muscle is supplied by the sciatic nerve, but what is true here, the long head is supplied by, okay, so the long head is supplied by the tibial component of the sciatic nerve. Tibial part of the sciatic nerve supplies the long head, and the short head is supplied by the common peroneal component. Okay, common peroneal nerve of the sciatic. Okay, common peroneal component of the sciatic supplies the short head of biceps. So if I want to say very strictly, all the hamstring muscles are supplied by tibial part of the sciatic nerve except the short head of biceps femoris, which is supplied by the common peroneal component of the sciatic nerve. So this is one thing you have to note here, guys. So biceps femoris, it has got two heads. Long head is supplied by the tibial component, and the short head is supplied by the common peroneal component. Short head is supplied by the common peroneal component. See, please understand, all these muscles are crossing the knee joint. They are crossing behind the knee joint. So all of them is going to cause knee flexion. So biceps femoris, what is the action? Biceps femoris action is, it causes knee flexion. It causes knee flexion. In addition to that, it also causes lateral rotation of the, it also causes lateral rotation of the knee joint. It also causes lateral rotation of the tibia. We can call this as, okay, it is called as a lateral rotation of the tibia. So biceps femoris helps in lateral rotation of the tibia. Okay, so that is what I have written there. So this is lateral rotation of the tibia and knee flexion are the two actions of the biceps femoris muscle. Biceps femoris muscle. Okay, now coming to the next muscle in this area, this is the muscle which takes origin again from the ischial tuberosity, and it goes and gets inserted in the medial surface of the proximal tibia. Okay, it is where it gets inserted. So guys, please remember, okay, so this is the proximal tibia medial side. Proximal tibia medial side, we have discussed this previously. There is two more muscles which gets inserted into this area, into the proximal side medial surface, that is sartorius, gracilis and semitendinosus. So I am not going into the details of sartorius again. So this muscle which is going to get attached into the proximal side of the tibia, proximal tibia is nothing but the semitendinosus muscle, is nothing but the semitendinosus muscle. Okay, this semitendinosus muscle is one muscle, okay, which is getting attached to the proximal tibia, and this muscle is supplied by, okay, semitendinosus is supplied by tibial part of the sciatic nerve. Okay, tibial part of the sciatic nerve, and this muscle again causes flexion of the knee joint. These are all the flexors of the knee joint. They are also causes medial rotation of the tibia. They also helps in medial rotation of the tibia. Biceps femoris is a lateral rotator of the tibia, whereas semitendinosus is a medial rotator of the tibia. Now can anybody tell me what is the bursa that separates the semitendinosus, gracilis and the sartorius here? What is the name of the bursa which supplies or which divides this area? So this is pes anserinus bursa. Very good, Hari. Very good, Shanmugapriya. This is pes anserinus bursa. Okay, so that we have discussed previously. So this is about the semitendinosus muscle. Okay, now coming to the next muscle in this area is the semimembranosus muscle. This semimembranosus muscle, again it takes origin from the ischial tuberosity. It gets inserted into the medial condyle of the tibia. Okay, so this is where it is getting inserted. So the insertion of the semimembranosus is into the medial condyle of the tibia, okay, medial condyle of the tibia. After it gets inserted, there is a fibrous expansion which goes to the lateral condyle of the distal femur, and this fibrous expansion also we have discussed previously. Can anybody tell me what is the name of this fibrous expansion which is forming the floor of the popliteal fossa arising from the semimembranosus called as, what is this fibrous expansion or what is this ligament called as? Very good, Shanmugh. This is called as oblique popliteal ligament. This is called as an oblique popliteal ligament. Very good, guys. This is called as an oblique popliteal ligament. Very good, Soumya. This is called as oblique popliteal ligament. Okay. So this semimembranosus is also supplied by what? This is also supplied by the tibial nerve, which is a part of the sciatic nerve. Okay. Okay. It is also acted upon, or the action of this muscle is, it causes flexion of the knee joint. It causes flexion of the knee joint. Okay. It causes flexion of the knee joint, and it also causes medial rotation of the tibia. It causes medial rotation of the tibia. It causes medial rotation of the tibia. That is the action of this muscle. That is the action of this muscle. Okay, guys, clear? So this is about the semimembranosus muscle. Next muscle in this region is the adductor magnus muscle. It's a very, very broad muscle. It has got two parts. One is called as an adductor part. Another one is called as an hamstring part. So what is this? So this is the adductor magnus muscle. It is adductor magnus muscle. It has got two parts. One is called as an adductor part, and another one is called as an hamstring part. Another one is called as an hamstring part. What you are looking here, that is taking origin from the inferior ramus of the pubic bone, is the hamstring part. The entire muscle goes and gets attached to the linea aspera, into the medial lip of the linea aspera. The terminal attachment is to a tubercle called as the adductor tubercle. So guys, please remember, this muscle, after getting attached to the adductor tubercle, it forms a ligament on the medial side of the knee joint. Can anybody tell me what is the ligament called as, or the remnant of adductor magnus muscle forms a ligament? What is the ligament? Very good, Anashwara. It is the medial collateral ligament. This is the medial collateral ligament. So this is the medial collateral ligament of the knee joint. Very good, guys. So the medial collateral ligament of the knee joint is nothing but a remnant of adductor magnus muscle. It is nothing but a remnant of adductor magnus muscle. So what is the attachment? So the adductor magnus is attached to the linea aspera. The end attachment is to the adductor tubercle. Now I will ask you another question. Adductor tubercle is used as a landmark to surface mark one important structure. What is the use of adductor tubercle? This adductor tubercle is used to surface mark one important structure in the thigh. Can anybody tell me what is the structure which is surface marked using this adductor tubercle as a landmark? Guys, anybody? What is the surface marking? I hope you have crossed about surface marking in your undergraduate days. So this adductor tubercle, okay. Yes, right. Yes, obviously adductor canal is just above the adductor tubercle, but that is not the important thing. So this is an artery which is present on the anterior aspect of the thigh. Yes, very good, Anashwara. It is femoral artery. Femoral artery, you have to surface mark the femoral artery by marking a line between the mid inguinal point to the adductor tubercle. So if you draw a line between the mid inguinal point to the adductor tubercle, that represents a femoral artery, guys. That represents a femoral artery. Very good. So this is the adductor hiatus which you see here. So what is this hiatus? This is called as the adductor hiatus. So this adductor hiatus transmits the femoral artery, and it also transmits a femoral vein through it. Okay. So this adductor hiatus is the last opening present in the adductor magnus muscle. Above that you got few more openings, and these openings in the adductor magnus allows the passage of the perforators of the thigh. So the perforators of the thigh, which are all branches of profunda femoris artery, passes through this hiatus in the adductor magnus, okay, and supplies this region. So the adductor magnus muscle has got several openings in it. This openings allows the passage of the perforators of the profunda femoris artery, and the last opening, that is called as adductor hiatus, allows the passage of femoral artery and femoral vein. thereby they become the popliteal artery and popliteal vein behind the knee joint, okay. Yes guys, you know about the adductor magnus nerve supply, okay. So what are the two nerve supplies for adductor magnus? So the adductor component is supplied by the obturator nerve, it is supplied by the obturator nerve, and the hamstring component is supplied by the tibial nerve. So you can see two different nerves, okay. You got two different nerves supplying this muscle. That is why when we are talking about hybrid muscle, we also reminded about adductor magnus muscle. It has also got two action. One is called as the adduction. It causes adduction of the hip joint, and it also causes, okay, it also causes extension of the hip joint. It also causes extension of the hip joint. So it not only causes adduction, it also causes extension of the hip joint, guys. So this is about the adductor magnus muscle. So take home messages, okay. So you should know about this ligament. Medial collateral ligament is the remnant of adductor magnus muscle, So we have seen about the hamstring muscles. So all these muscles are supplied by the tibial component of sciatic nerve, except the short head of biceps femoris, So that is what we saw now, okay. Now coming to the next important topic, okay, next very important topic, that is the knee joint ligaments, guys, okay. See, in the afternoon, I think, see, after the lunch session, the first thing we'll be discussing about the joints. So at one shot we'll be seeing all the joints of the upper and lower limbs, but at this junction, since we have a picture here, we'll discuss about knee joint here, and then we'll go to the rest of the joints in the afternoon session, okay. See, this joint, what you see here, okay, is an synovial joint. We'll all discuss about all these varieties, okay. So knee joint is an example for an synovial joint, okay. Knee joint is an example for an condylar joint, okay. Since there are two condyles of the distal femur articulating with the tibia, this is called as a condylar joint, okay. This joint is an modified hinge joint. What is this? This is an modified hinge joint, okay. So I hope you know what is called as an hinge joint. If there is an hinge joint, you can able to do movement through only one axis, guys, okay. If it is an hinge joint, you can do movement only through one axis. See, for example, if you take an interphalangeal joint, these interphalangeal joints are example for hinge joint. In the interphalangeal joint, either you can flex or you can extend. The interphalangeal joints are examples for hinge joints. When it is an proper hinge joint, only one axis it will move. It can either move in flexion or it can move in extension. So you can move it only in one axis. So that is called as an hinge joint. But if it is a modified hinge joint, some other movements can also take place. So knee not only allows flexion and extension, it also allows little bit of rotation. That is why knee is called as an modified hinge joint. This is again a compound joint. What do you mean by a compound joint? When more than two bones articulate here, okay. So that is called as an, okay. So when more than two bones articulate, that is called as a compound joint. Now tell me, what are the two bones or the three bones which articulates here? The three bones which articulates in the knee joint are the femur bone, the distal femur, the proximal tibia, okay, and the patella. So these are the three bones which articulate in the knee joint. So please remember, guys, here again, fibula is not a part of knee joint. Though you see the fibula here, fibula is not a part of knee joint. You have to see, or you have to draw patella here. Patella is a part of the knee joint. And fibula is not a part of the knee joint. So please keep this in mind. And when you classify the knee joint, you can also classify the knee joint, and you can call this knee joint as a complex joint. Knee joint is an example for a complex joint. What do you mean by a complex joint? Whenever there is a joint space, okay, and if this joint space is separated by a meniscus or an articular disc, okay, if this joint space is separated by a meniscus and articular disc, you see meniscus here, you see meniscus here, the joint space is separated by a meniscus, then that is called as a complex joint. So if you want to classify the knee joint, you can call the knee joint as a synovial joint, you can call the knee joint as a condylar joint, you can call the knee joint as a modified hinge joint, because in two axes it moves, it not only allows flexion and extension, little bit of rotation takes place. So that is why it is called as a modified hinge joint. Since more than two bones articulate here, it is also called as a compound joint. Okay, and please remember guys, it is a complex joint since the joint space is divided by the meniscus, So since you know about a lot of things about knee joint, now we'll go into the ligaments of the knee joint. Okay, so the important ligaments in the knee joints are, okay, so the important ligaments in the knee joint are, one is the collateral ligaments. So the collateral ligaments are two in number. One is called as the medial collateral ligament, and another one is called as the lateral collateral ligament. And where do these ligaments attached? Yes, the medial collateral ligament is attached to the medial epicondyle. It is attached to the medial epicondyle of the femur, and distally it is attached to the proximal tibia. It is the attachment of the medial collateral ligament. And where does the lateral collateral ligament attach? So these are all the attachments, and the lateral collateral ligament is attached to the lateral epicondyle. It is attached to the lateral epicondyle of the femur. And where it is attached distally? It is attached to the head of the fibula. Okay, it is attached to the head of the fibula. So medial collateral ligament supports a joint on the medial side, okay, and the lateral collateral ligament supports a joint on the lateral side. Medial collateral ligament, MCL, is a remnant of, we have seen this, it is a remnant of adductor magnus muscle, whereas the LCL is a remnant of, can anybody tell me? LCL is a remnant of guys, yes, anybody? LCL is a remnant of, lateral collateral ligament is a remnant of, okay, it is a remnant of peroneus longus muscle. Guys, it is a remnant of peroneus longus muscle. Okay, so you should know about this remnants. Sometimes MCQ comes in this area. So medial collateral ligament, remnant of adductor magnus muscle, whereas the lateral collateral ligament, it is the remnant of peroneus longus muscle. We'll discuss in short while. So these are the two important collateral ligaments. Now medial collateral ligament can be checked by a test called as valgus stress test. You can check the medial collateral ligament by a test called as valgus stress test, and you can check the lateral collateral ligament by a test called as varus stress test. So you can stress the joint in valgus or varus, and you can test these ligaments. So one is called as the valgus stress test for the medial collateral ligament. Okay, so valgus stress test for the medial collateral ligament, and varus stress test for the lateral collateral ligament. Okay, for the lateral collateral ligament. So this is about the collateral ligament. So next comes the ligaments within the joint, that is called as a cruciate ligament. Okay, as we have discussed about these cruciate ligaments, there are two cruciate ligaments. One is called as an anterior cruciate ligament. The next one is called as an posterior cruciate ligament. Okay, so the anterior cruciate ligament is attached. Where it is attached? It is attached to the proximal part of the tibia on the intercondylar area. I will just show a picture so that you can able to understand it very clearly. Okay, so you can see the tibia here. So this is the proximal tibia. This area is the intercondylar area. This is called as the intercondylar area. And where it is attached? It is attached to the anterior aspect. It is attached to the anterior part of the intercondylar area of the proximal tibia. This is the attachment of, or it is the tibial attachment of the ACL. It is the tibial attachment of the ACL. Okay guys, clear? So this is called as a tibial attachment of the ACL. Okay, so what is the other attachment? This fibers of the ACL runs superiorly, runs posteriorly, okay, and runs laterally and goes and gets attached to the medial surface of the lateral condyle. So it is goes and attached to the medial surface of the lateral condyle. So where it is attached? It is attached to the, okay, it is attached to the medial surface. It is attached to the medial surface of the lateral condyle. It is attached to the medial surface of the lateral condyle. Okay, it is attached to the medial surface of the lateral condyle. And what is the attachment of PCL? Okay, what is the attachment of PCL, guys? So we were discussing about the anterior cruciate ligament. As we have seen the picture here, you can see the anterior cruciate ligament tibial attachment is here on the intercondylar area more anteriorly, and when you trace it behind, the anterior cruciate ligament runs postero-superiorly towards the lateral condyle and gets attached to the medial surface of the lateral condyle. This is the attachment of ACL. And what is the attachment of PCL, guys? Yes, so the attachment of PCL is on the posterior part of the intercondylar area. So this is the area where PCL is attached, and it runs superiorly and anteriorly, and it goes and gets attached to the lateral surface of the medial condyle. It goes and gets attached to the lateral surface of the medial condyle. So what is this? So this is PCL. So PCL is attached to the medial condyle, and ACL is attached to the lateral condyle. ACL is attached to the lateral condyle of the femur. Okay, ACL is attached to the lateral condyle of the femur. Okay, now if you take ACL and PCL, okay, so we are discussing about ACL and PCL here. So if you take ACL and PCL, okay, so they are attached to the lateral condyle of the femur. ACL is attached to the lateral condyle of the femur, whereas PCL is attached to the medial condyle of the femur. It is attached to the medial condyle of the femur. It is attached to the medial condyle of the femur. Okay, now ACL is taut. Okay, it becomes tight. Okay, it becomes tight in knee flexion. It becomes tight in knee flexion. Okay, so when you flex your knee, okay, the ACL becomes tight. Okay, and this PCL will become tight in extension. PCL will become tight in extension. This prevents the forward displacement. It prevents a forward displacement of the tibia, whereas this prevents the backward displacement of the tibia. This prevents the backward displacement of tibia. Okay, this prevents the backward displacement of the tibia. Okay, clear? This prevents the backward displacement of the tibia. ACL, when it gets injured, okay, so you can check the ACL by anterior drawer test. You can check the ACL by anterior drawer test. Okay, you can check the ACL by pivot shift test. You can check it by pivot shift test. Okay, you can check the ACL also by, okay, you can check the ACL also by a test called as Lachman's test. By a test called as Lachman's test. These are certain tests for checking the ACL. For checking the PCL, you can do the following clinical tests. You can do posterior drawer test. Posterior drawer test. You can do a test called as a reverse pivot shift test. Reverse pivot shift test. Reverse pivot shift test. And you can also do a SAC test. You can also do a SAC test. So these are all the important points related to PCL and ACL, guys. So many times in orthopedics also they ask a lot of these questions regarding ACL and PCL. So I think we have enlightened about ACL and PCL. Now we'll go to the meniscus. Okay, so meniscus. So I hope there are two meniscus within the knee joint. You know that. Okay, so if I draw the proximal tibia, so this is the picture of proximal tibia. This is the picture of the proximal tibia. Okay, and just on the lateral side of the proximal tibia you get a bone. This is fibula bone, this is fibula bone. Okay, over the superior surface of the proximal tibia you get two meniscus. One meniscus is more oblong in nature, it is semicircular in nature. The other meniscus is almost like a C-shaped circular in nature. And what is this meniscus? This meniscus, which is oblong in nature, is nothing but the medial meniscus, and the meniscus which is almost circular is lateral meniscus. That is what they are asking. What is the shape of the medial meniscus? The shape of the medial meniscus is semicircular. It is semicircular, okay, or it is oblong in shape. It is oblong in shape. Whereas the lateral meniscus is nearly circular. It is almost near circle. So it is nearly circular. Okay, and the medial meniscus is attached. Okay, you get a ligament on the medial side. This ligament is called as the medial collateral ligament, and the medial meniscus is attached to the medial collateral ligament. So the medial meniscus is attached to what? It is attached to the medial collateral ligament. On the lateral side, you can ask me, sir, there is no lateral collateral ligament. Yes, there is lateral collateral ligament here, but this lateral collateral ligament is not attached to the lateral meniscus. There is a muscle which intervenes between these two structures that is running posteriorly. This is an intra-articular muscle. Okay, this is an intra-articular muscle. This muscle prevents the attachment of lateral meniscus and the lateral collateral ligament. And can anybody tell me what is the muscle that arises within the knee joint? Yes, guys, what is the muscle that arises within the knee joint called as? Yes, very good, Anashwara, it is popliteus. Now there is a next question in this junction. There is one more muscle which takes origin from within a joint. It has got an intra-articular origin. Popliteus muscle, yes, very good. Popliteus muscle, it has got intra-articular origin. Intra-articular origin, very good, Charu, and very good, Anashwara. You guys are doing great. So there is another muscle which takes origin from the joint, within the joint, that is biceps. But specifically if we want to say, this is long head of biceps. The long head of biceps takes origin from within the shoulder joint. The long head of biceps takes origin from within the shoulder joint. So they are intra-articular in nature. Now here the popliteus muscle is the muscle which separates the medial meniscus, which separates the lateral meniscus from the lateral collateral ligament. So here the lateral meniscus is attached to the popliteus tendon or the popliteus muscle. It is not attached to the lateral collateral ligament. This is very important. This is very important. So in knee injury, okay, medial meniscus is affected. Okay, usually in knee injury lateral meniscus is not affected commonly, okay. So in knee injury this is affected because of its attachment to the medial meniscus. It is not able to move freely. So whenever there is a knee injury, along with the MCL, there can be an injury of medial meniscus also. Okay, whenever there is an injury of medial collateral ligament, you can see the medial meniscus getting injured. Along with the medial meniscus, you can also have injury to the ACL. So if all these three ligaments are injured, okay, if there is an ACL rupture, plus if there is a medial meniscus rupture, plus if there is an MCL tear, so when there is a tear in all these three ligaments, this is called as what? This is called as a terrible triad of knee. It is called as terrible triad of knee or an unhappy triad of O'Donoghue. It is called as a terrible triad of knee, also called as an unhappy triad of O'Donoghue. So when you talk about unhappy triad of knee, where ACL, medial meniscus and medial collateral ligaments are injured, you must also remember about the terrible triad of elbow. There is a condition called as terrible triad of elbow, guys. There is a condition called as terrible triad of elbow. In terrible triad of elbow, there will be coronoid fracture, there will be radial head fracture, along with radial head fracture you will also have the elbow dislocation. So whenever there is an elbow dislocation along with radial head fracture, along with coronoid fracture, this is called as terrible triad of elbow. This is called as terrible triad of elbow. This is called as terrible triad of knee, also called as O'Donoghue, and this is also called as terrible triad of Hotchkiss. This is called as terrible triad of Hotchkiss. So this is called as terrible triad of Hotchkiss. Okay, so this is about the two terrible triads around the hinge joints, one around the elbow and one around the knee. Now when you take a section like this, okay, this is again a frequently asked question. They might put a mark like this and they can ask you what does this structure represents. So when they put a structure like this and when they show this intercondylar area of the tibia, so there are various structures which are attached in this. Okay, so what are these structures represents? So these structures represents the attachments of the medial meniscus, lateral meniscus and the collateral ligaments on the tibia. Okay, now if you want to understand this, you can easily keep a mnemonic. One is called as Medical College Lucknow and next is called as Lucknow Medical College. Okay, I'll just read once again. So this is called as Medical College Lucknow, and you can reverse it as Lucknow Medical College. So this is how we remember the attachments or the proximal tibia. So the first M stands for the medial meniscus. So this is the anterior horn. Of medial meniscus. Next comes the cruciate ligament. This is the ACL which is attached to the anterior part of the tibia. Next comes the anterior horn of lateral meniscus. Next comes the posterior horn of lateral meniscus. Next comes the posterior horn of medial meniscus. Okay, and the last one is the PCL here. So if somebody asks you what are the structures which are attached on the superior surface of the tibia, okay, so you can say that from the anterior to posterior, the anterior horn of medial meniscus is first seen. Next comes the ACL. Next comes the anterior horn of lateral meniscus. Just behind that, since this meniscus is circular, you get the posterior horn of the lateral meniscus, posterior horn of the medial meniscus. The last structure here is PCL. Okay, Now, can anybody tell me what is the most anterior structure in the knee joint? Only these ligaments, or do you see any ligaments which is here? Can anybody tell me what is this tuberosity called as, guys? You see a tuberosity got an elevation on the anterior aspect of the tibia. What is this tuberosity called as? Can anybody tell me what is this tuberosity called as? This tuberosity is called as an tibial tuberosity. And there is an important ligament which is attached to this tibial tuberosity. This ligament which is attached to tibial tuberosity is the ligamentum petallae. So it is the most anterior structure here. Behind that, all these structures are arranged. So what is this structure? This is called as ligamentum petallae. Guys. This is called as ligamentum petallae. So these are all the important ligaments of the knee joint. So you got collateral ligaments, you got the medial collateral, you got the lateral collateral ligaments. Okay, and you got the cruciate ligaments. Okay, anterior cruciate and posterior cruciate ligament. You got the meniscus. Okay, so these are all the important ligaments. Apart from this, you got small ligaments like arcuate ligament, you got the coronary ligaments, you got the transverse ligament, and you got the oblique popliteal ligaments. All these are small ligaments, not much of importance at this junction. Just I want to emphasize one more point here. So whenever there is a meniscal injury, you can do certain test to find out the meniscal injury. One such test is called as McMurray test. Then there is a test called as Apley's. Grinding test. Then there is a test called as Apley's grinding test. Okay, then there is a test called as Thisalis test. So these tests are tests to check the medial or the lateral meniscus tear. So whenever there is a meniscal tear, if you suspect meniscal tear, you can do this test to check the meniscal tear. Okay, so this is about the knee joint. So knee joint is supplied by, it is supplied by femoral nerve, it is supplied by obturator nerve, it is also supplied by sciatic nerve. All the three nerves supplies the knee joint. but one important thing is, okay, one important thing is obturator nerve supplies both the knee joint, it supplies both the knee joint and the hip joint, it supplies both the knee joint and the hip joint. That is why if you have a pathology in the hip joint, the pain can be referred to the knee joint, the pain can be referred to the knee joint. Sometimes a patient has got a pathology in the pelvic region or in the hip region, but he will present to you with a complaints of knee pain, you will come to you with complaints of knee pain, but the actual pathology is higher up. Why? Because obturator nerve supplies both the hip joint and knee joint. So if there is a pathology in the hip region, the pain can be referred to the knee. So that is the importance of this dual nerve supply. Okay, fine. So this is about the ligaments of the knee joint. I hope you are clear with the ligaments of the knee joint and the important things which are related to the ligaments of the knee joint. Okay, so I think we can have a break for the lunch, guys, now. And when we come back to the afternoon session, only small part of lower limb is left, and after that we have got something to do with the joints. So we'll try to rush up with the joints and the other parts of the leg. They're all small topics, and after that we'll go to the abdomen today evening. Okay, fine. So have a good lunch, and we'll be resuming our class in an hour. Okay, thank you.